All right, good morning, everybody. Thanks for being here this morning. Welcome to our May 14 briefing. Earlier this week, I showed you some data on COVID positivity rates in our community. And, I just want to reinforce why we look at positivity rates. There's a ton of metrics that we're looking at on our response here, but that's an important metric from a public health approach because it gives us somewhat of an idea of what the community spread is like in our community. But know that, again, it's not the only metric that we're looking at on a daily basis. As we continue to look at our mitigation efforts that we have put in place in the phased reopening plan for businesses that's going on, as well within the city, we'll be monitoring a lot of data in the weeks ahead. We've have this, what we're calling this no mingling ordinance that's been in effect about a week now. I want to reinforce patience with this and the nimbleness that's needed for some of these businesses to operate. We live in probably the most impatient time in the history of our country. We're used to immediate information. I can go online, I can get it. If it takes too long to load, I go to another web. We want answers, quick. And the COVID response is a patient process. And what I have to tell people is the answer you're looking for right now is a process. The answer is a process. This is another step in the process. It's easy to be impatient. It's hard to be steadfast. Okay, so please give us patience. It's been in effect for about a week. Businesses are learning how to operate within that. It's been going well. So we thank you for the community's patience in that and the community's patience on that. I only got one slide of data today, and this format you're going to be seeing more often from us. So we want to get consistency in the way we're presenting data to you all, and this is something that we'll show on a more regular basis. And this reinforces that percent positive testing metric that we're looking at. So what you're seeing here is on the far left, that line, or that bar I should say, is April 22 to April 29, and it shows roughly the number of cases, the blue being the number of negative cases. Again, I'm colorblind, I think that's orange. Orange is the percent positive cases. And so we had about a 22.1% positive rate that week. Following week, 430 to 56, we did less testing, but we also had a lower positive rate by a little over 1%. We had obviously the large Smithfield community specimen collection site. As those results came in, while we did a lot of tests, we dropped down over 2% and now to an 18.5% positivity rate. This is an important metric to watch because that will give us the spread. If this had shot up to this, it tells us there's much more spread happening. So this is a very important number, a number that we'll continue to report on, along with other numbers that we're monitoring within the city. So couple logistical things. We will have some of our physical buildings in the city that will start opening this coming Monday. So for those of you who are watching and want to know when you can actually access services within some of our city buildings, at City Hall starting Monday, our customer service desk with utility billing, public parking, that will reopen for normal business. We still would prefer that people wear face masks when they come in to do business with the city. We had some debate on this. Do we require it? Do we prefer it? There's some people who are really dug in on not wanting to wear a face mask, and we don't want to preclude them from doing business with the city without that. But for the respect of our city staff, we would ask that you would do that if you're comfortable and inclined to do that. Some things you can do: use a credit card whenever possible, so we don't have to exchange, cash, change. You can still pay things online over the phone. Citations for public parking, although way down, obviously those can be paid online. If you need services from our human resources, our human relations department, city attorney's office, GIS, finance, you can make appointments with those teams and come into City Hall and see them at any time as well. We also begin receiving bids. That will move back to the ground floor service desk effective next week as well. So just to kind of put an exclamation point on that, you have seen government have to be so nimble and change their operations so quickly through this, and it may not seem like a big deal to you all, but I am so proud of how the city has responded to this. We had a snow event in the middle of all this early on, and we were dispatching plows and taking customer service calls from the basement of one of our employees' homes, and I mean, that's pretty unbelievable for us to have shifted operations like that. So we will begin phase reopening next week of those. Same with City Center. We'll begin some reopening our service counter. We have barriers in there in place, and Carnegie Town Hall will also be reopening to the public. So before I turn things over to Jill Franken, our Public Health Director, I want to remind everyone that this Saturday is Armed Forces Day, and our Air National Guard are going to be doing a flyover to honor our COVID-19 first responders and healthcare heroes in the community. So they'll be flying over a number of communities throughout the eastern part of the state. And in Sioux Falls, we anticipate that between 2:50 and 3 o'clock. So 2:45 to 3 o'clock in there. Go outside, take your kids outside, take your family outside, and enjoy the Air Guard flying over, and remember our first responders and our healthcare workers at that time. So with that, I'm going to turn things over to Jill Franken. You have a question for me before I turn over here?
Yeah,
Absolutely.
I was wondering about parks, like the visitor center at Falls Park, restrooms, that kind of thing.
Yeah, they're still closed. We're working on the reopening plan for those as well. That will probably roll out, let's see, the 29th, when we're making the announcement of what we're going to do with all the organized sports leagues and so forth. So more to come on that. Jill?
You bet. Good morning, everyone. So as we've shared with you over the past several weeks, the city's been coordinating a community mitigation effort to offer non-medical sheltering opportunities to our vulnerable populations in our community that are not able to quarantine or isolate where they live. And just a reminder to everyone, if you are in quarantine, that means that you've been in close contact with someone who's positive for COVID and then need to be in then quarantine for a period of time. And then isolation is if someone is positive for COVID and they need to isolate themselves throughout their symptomatic period. And so this is the Recovery Center is a place where we are able to provide that service for someone who doesn't have a place to do that successfully and is in our vulnerable population group. Since the beginning of the pandemic, or since about mid-March, we've actually provided services to 133 guests to offer this. Yesterday morning, we received notification that one of our guests had passed away in their room overnight on Tuesday night. Certainly, this is something that's very sad for this the family of this individual, and we do express our very deep sympathy to the person's family and friends of that person who passed away. Just a reminder that this an isolation center such as this is a non-medical shelter. People who stay here, they're medically stable. They've not been found necessary to be hospitalized by their provider, but they simply need a room to be able to either isolate or quarantine. And so guests are offered meals. We also do their laundry. And so therefore, there's several times a day where we're knocking on their door and they're taking in their laundry or they are taking in their meals throughout the day. So it's something that we felt we needed to share with the community today. And with that, I'll turn it back over to Mayor Paul.
Thanks, Joe. All right, so we have today. Any questions other than the one Rock asked?
I just have one. You mentioned that
Yeah.
businesses were trying to find ways to follow the guidelines. Can you explain any of the tactics that they're using in order to try to get reopened?
The question was, what tactics are businesses using to reopen? One, they're obviously getting very creative with how they've done seating in the past. They're turning, maybe if they had an event part of their business, that now could be included in their dining seating because they can't have large events in there, so they're spilling over their dining because that's part of their overall capacity. So they're doing things like that. I'm seeing a really intentional effort with contactless menus and all things, things that make the customer feel very safe and comfortable going into a business. I saw one business that actually is just using QR codes on the table where you scan the QR code, you get the menu on your phone, you order off that, so they don't have to print menus, they don't have paper menus, anything. It's all just digital, which I think is a great option as well. So seeing some, these are small businesses and they're entrepreneurs by heart, so they're coming up with some interesting ways to keep their patrons safe, keep their guests safe, and stay open.
I'm guessing you find that encouraging.
Yeah, very encouraging. And that's, to my earlier point about patience, both the customer needs to have patience, but these businesses need to have patience as well. So they want to say, can we just, lift the lid off this? Let's just reopen. Let's go. Let's get back to normal. It's like, listen, we are still, as you can see by the data, we're still monitoring this. We still need to see a longer downward trend trajectory. There's a lot of cities and states in this country who are not taking some of the steps we're taking here in Sioux Falls with way less cases than we have here in Sioux Falls. And so it's important to realize that we're being quite aggressive in this city, okay? And the whole point of everything we've done to date, and this gets lost in the dialogue, was to flatten the curve, okay? That's, I think, the very first press conference. We'd show you the curve, there's a spike, the goal is to flatten it, here's the healthcare capacity. Somewhere along the way, that dialogue has changed to tracking deaths and tracking all these other things, which we're obviously watching and we're reporting on, but we're not stopping COVID. We're not going to put an end to COVID. We're slowing it down, okay? And so these steps that we're taking with this are meant to slow that down, okay? And keep that slow. So we have to have patience. This virus requires patience.
How important is it to remind residents that we haven't peaked yet here in Sioux Falls?
Well, that's very important because I've used the term a lot. My team's sick of hearing me say this about spiking the football. It's like, all right, we're done. We're good. We never saw the, couple thousand beds that we thought we were maybe going to need, and we're right, we didn't. There's been a lot of missed projections in this, federally, state, citywide, because we don't know a lot about this virus. But we still are expecting to see an increase in cases as we continue to go through the summer months. That will just continue to happen. So it is not a time to take victory lap. That's why we have to have these ordinances on the books and still continue to do these things. So the community and the public is going to have to continue to learn to coexist with COVID. We have to learn to live like this for a while. We have to learn to live with masks and live with how restaurants and bars are going to operate and live with a Costco or a Menards requiring a mask if you go in there. That's just going to be reality for a while.
You mentioned masks. I don't know. There's a lot of places I see maybe 50%, maybe. There's just a whole lot of people that won't wear a mask. And what would you say to them?
I would say that the purpose of wearing the mask, again, is to prevent you from spreading COVID to other people. So for me personally, just like I wouldn't walk into a convenience store and sneeze on the person working there or swing my fist at them, I'm also not going to breathe potentially contaminated air onto them. And so how I can do that is by wearing a mask. So you will see me wearing a mask in public when I go to businesses. I think the public should as well. But the mask, for whatever reason, has become the symbol of controversy in this whole thing, which is lost on me. It makes no sense why this is controversial to wear a mask and protect other people. It's people's freedom, it's their liberty, all that, and I don't understand it. So I'll stand up here to say, wear a mask. We'd love you to wear a mask whenever you can. We don't have any laws in this city requiring it, but it is the right thing to do, in my opinion.
So we have not peaked yet. When do we think the peak will happen?
The latest data we had showed us peaking at the end of this month and early into June, and that's the latest projection that we have. So we can continue to operate off that, and until the data changes and the numbers change on us, we'll adjust accordingly. So I'll be honest in that that's been such a moving target for a lot of people, state included, this city and this county included. But we do have to remember that 90% of the cases of COVID in this entire state are within this MSA. And so we saw how quickly Smithfield could flare up. I mean, there's several larger businesses that are opening up to some pretty large capacity that are even outside of the Sioux Falls city limits that, it's pretty easy to become a hotspot if they don't have the right CDC guidelines that they're implementing. So we have to just continue to be cautious. All right, thank you, guys. Appreciate your time today.